Today in our continuing series on Medical Monday with the doctors at Moffitt Cancer Center, we're discussing cancers of the urinary tract and genital organs. Here today is Monica Chatwal. She's a medical oncologist in the Department of Genitourinary Oncology. Thank you for being here.
Thank you for having me.
Yeah, it's wonderful to have you here. You know, Moffitt is a very high volume. It is NCI designated cancer center, which treats these kinds of cancers with some concentrated programs for even the really rarest malignancies. So talk to us a little bit about what diseases you treat.
Sure. So in our genitourinary program, we treat cancers of the urinary tract and male genital system. So that typically includes bladder, testicular, kidney, penile, and prostate cancers.
So when we're talking about a lot of these really rare diseases and rarest malignancies, is that really a lot of what you're dealing with?
Well, not necessarily. So sometimes we're dealing with kind of the bread and butter, bladder cancer, prostate cancer, kidney cancers, and then sometimes we do see some of the more atypical forms of those cancers or some of the less common cancers that we may see of those tumor types.
So when we're talking about something like that, and whether it be, you know, what you mentioned, like a bladder cancer or something much more rare, what then sets Moffitt apart from other cancer centers?
I think one of the best parts about Moffitt is that we really are a comprehensive cancer center where everything's kind of held under one roof, right? So for a patient who has a newly diagnosed bladder cancer, for example, they may need to see a urologist, they may need to see a medical oncologist, a radiation oncologist, they may need different types of therapies. So rather than having to go to multiple different places, multiple different centers, getting their imaging done at one place and their surgery at another place, everything can be housed under one major institution or location. And so oftentimes, we work together as a team, and the patient may actually be able to get a lot of this done in the same day or within the same week, which I think makes it a lot easier for patients and caregivers when they're dealing with something so difficult.
I don't think people think about all the other steps that come with a cancer diagnosis. There's so much more that they are dealing with than just that first diagnosis and treatment.
Absolutely.
And you can get that all at Moffitt, which is great. So let's talk a little bit more about those offerings that you're talking about. How does that then translate to better outcomes and really quality of life for your patients?
Yeah, I think one of the best parts about our program in specific is that, we have some very well-trained physicians, both in urology, in medical oncology, but then also in radiation oncology, and we work very well as a team in almost this multidisciplinary way, and that really translates into very high quality care. So the level of expertise that our physicians can provide, these are physicians who are nationally but also internationally recognized, and they can bring their research, they can bring their surgical techniques to these patients to provide the best level of care. We have weekly multidisciplinary tumor boards where we review cases, some that are very simple and straightforward, some that are a little bit more unique. Mm-hmm. And that really gives us the opportunity to explore other treatment options. We have different people who can give their expert opinions on different procedures like ablations, organ preserving surgery, robotic surgeries, whatever the case may be. And so that really helps, I think, to expand creative options for our patients, kind of outside of the box.
Yeah.
And we also have a very robust clinical trial portfolio that we can help to offer patients. And so if there isn't something that applies to them, or there may be an investigational or other opportunity for treatment, we have clinical trials both within Moffitt that our clinical investigators are creating themselves, mm-hmm. developing, running, and those that we run in conjunction with other major institutions in the country and internationally. And so those are some of the unique opportunities that patients have the ability to partake in.
If someone's listening to this right now and they wanted to explore this as an option, how do they make an appointment?
Yeah, I think they can either go to moffitt.org and online they can follow the prompts to establish as a patient, or they can call the number on the screen and someone's happy to help them out and get plugged in.
Yeah, well, thank you so much for being here, and thank you for what you're doing for so many people.
No problem, thank you.